More details tonight about sweeping new legislation that will eventually change healthcare delivery as we know it. Alberta's government will soon allow some health professionals to work in both the public and private systems simultaneously. It's an effort to cut down wait times, but critics believe it could flip the entire system on its head. Tim Brooke explains.
In a social media video, the province is shedding some light on its new healthcare plans.
We're calling it the dual practice surgery model, and here's how it will work.
Surgeons will soon be allowed to offer elective procedures paid for by patients or their insurance after they commit to a minimum number of publicly funded surgeries per year.
A surgeon could choose to perform publicly funded surgeries during regular business hours, while performing private surgeries after regular business hours or on weekends.
The plan is aimed at cutting high surgery wait times, a stat that currently leaves many far beyond safe thresholds.
This is another avenue where medical professionals and Albertans can connect and perhaps do additional surgeries that are currently done out of province.
But it won't just be surgery. Alberta's Minister of Hospital and Surgical Health Services says there are plans to broaden out the model to allow other health professionals a chance to mix public and private care. He wouldn't say what healthcare providers will be impacted.
They did not campaign on this. They do not have a mandate. Call an election.
That's right.
Some health professionals already work outside of the public stream, but the things they do, cosmetic surgeries, for example, are not covered by public insurance. Experts are convinced these changes will only further incentivize private practice.
If we look at the evidence of other jurisdictions, the public system has suffered where the private system has been able to flourish. And to the extent that it hasn't, it's been because of extensive government regulations to try to manage that.
And the market will no doubt also dictate higher private costs for those who can afford to skip the public line.
It will create a grossly inequitable healthcare situation, and we're all very, very worried about it.
The legislation will be introduced this session. Tim Brooke, CTV News, Calgary.
The Health Ministry wouldn't tell CTV News the minimum number of publicly funded procedures that surgeons must do every year. It would only say specifics will come when the bill is tabled.